the Upper Cumberland. It's another chilly December day across Tennessee. There's a lot of darkness still looming on the horizon with our COVID numbers rising and this worldwide pandemic still evolving as we speak. Yesterday was another record day with the holiday season upon us and with college students returning home for the holidays. It appears now that our numbers are going to continue to rise over the course of the next couple of weeks. Every college and university across the world has been faced with some hard choices over the last 10 months. Leadership has been important in combating these challenges on all of our campuses, and UT President Randy Boyd has stepped up and taken action, and he, along with Chancellor Plowman, have been very successful in protecting the safety and security of all the students and faculty and staff and athletes on the UT campuses. Today we will be welcoming President Randy Boyd to the BLTV show. He's the founder of Radio Systems, which is the invisible fence that many of you have at your homes. Boyd Sports, he's also been the architect of Tennessee Achieves and Tennessee Reconnect, and was a big proponent of the Drive to 55 that Governor Haslam actually helped initiate, that helped pay for a robotics center here in McMinnville. Randy was raised, and he was born in Knoxville as well, attended UTK. He's been a philanthropist. Our dog park here in McMinnville was funded through his foundation. He's a long-distance runner, and he and his wife, Jenny, have children and grandchildren and reside in Knoxville today. So today we welcome UT President Randy Boyd to our show. So welcome, President Boyd.
Jimmy, thank you so much. Or Executive Director Haley, thank you so much for the invitation and being able to join you guys today. I'm sorry that I'm not physically in McMinnville today, but had a lot of great visits there with you usually, and from dog park grand openings to talking about higher education initiatives, and so it's always great to connect with my friends from that part of the state. You mentioned a couple of things. Maybe if you want, I'll just go ahead and maybe talk about a few things that are really important with regards to the university and the pandemic that we've been facing. But you're absolutely right. We have had to make a lot of tough choices. It is a system, however, and it is a series of chancellors, and I have to commend all of our great chancellors, not just Chancellor Plowman, but also Chancellor Carver and UT Martin, Chancellor Engel at UT Chattanooga, and Chancellor Schwab at UT Health Science Center over in Memphis. We've all worked together on confronting this pandemic and worked in lockstep to make sure that we kept our students safe while giving them a great education. Here's the headline. At the end of the fall semester, after a lot of hard work by these leaders and their teams, we had 52,559 students enrolled at the start of the semester, which is, by the way, an all-time record, 1.9% greater than we've ever had before. So all-time record in new students, and we managed to get them all through classes, and some that were graduating to get them to graduate on time. Experience wasn't always what they had liked. A lot of classes were online. When they were in class, they had social distancing. They were wearing masks. They had to be behind plexiglass screens. But at the end of it, all 52,559 graduated or successfully completed their classes without a single one getting fatally ill. We actually, out of the 52,559, only 2 that we know of actually went to the hospital, and those 2 were only there for less than 2 hours. And we kept our campuses being the safest places, or some of the safest places they could possibly be. We look at stats across the state. 17 to 25-year-olds, as of last week, 17 to 25-year-olds across the state, 2.74% of them had COVID, were active cases. But on our campus, only 0.4% had COVID. So we're 6 times safer than the population at large. So it was the safest place for these students to be was there. And so we've done, I think, a good job of keeping our students safe and healthy, and getting them the education that they need and deserve.
Well, I know that COVID is kind of affected the revenue stream at the universities across the system, particularly in the sports program. So Would you like to address that a little bit and where you stand as far as revenue streams for the UT system?
Yeah, no, a great question. And so, yeah, we talked about this at our board meeting about 3 weeks ago, so I'll give you the numbers from that, excluding athletics, and we'll come back to that, but excluding athletics, the University of Tennessee system across the state has lost $95 million in revenues. However, there's been a lot of offsets. Like one example would be, so our students in the spring they canceled their meal plans because they weren't there to eat, but at the same time, we didn't have to make the food. So some of the things that you didn't get paid for, you didn't have to provide. And a lot of these things are done at cost or for not very much margin at all. So the revenue was almost completely offset by the savings and costs. We also got some CARES money. We got $21 million that we were able to use to offset our expenses. We actually got a total of $37 million, but the rest of it, $15 million, went directly to students. But of the $21 million, $21 million of it we got to keep and help offset some of our losses. We also just found ways to save money. With some of our deferred maintenance, we found over $10 million in savings in deferred maintenance. So we still did the repairs we needed to do, but found ways to do them cheaper. So the net of it was we saved $85 million. So if we against the $94 million in lost revenue. So the actual bottom line effect was a loss of $9 million. And $9 million is important, and it's a lot of money, but we have a $2.5 billion overall budget, and $500 million in reserves going in. Now, these reserves are set aside for very specific things. It's not like we just money laying around with no purpose. It was things that were set aside for very specific things. But the good news is we had at least the cash available to be able to do the things we needed to do. And then over time, we've got to build back those reserves for those things that reserves were set aside for. So financially, we've managed to weather the storm. Now, athletics is a moving target. It depends a lot on what happens with basketball games and football games, and we've had many canceled, many get postponed. So numbers keep changing. Early in the year, we were estimating that the loss in athletics just at UTK could be as much as $40 million. So we've been looking at other ways to try to mitigate some of those costs. There's opportunities to get advances from the SEC for our big TV contracts. There's salary reductions. I know at UT Knoxville, many of the staff and coaches took a salary reduction, and we've looked at other ways in which to reduce costs as well. On the attendance side, both at basketball and football, where we've been, as probably most of your fans or listeners know, been at 25% capacity, and so that's been a bit of a hit to the bottom line, but we felt like it was the safe thing to do. And so far, there has not been reports or anything that we've been able to see where any of these events have had a negative impact on public health, something that we track constantly. And so far, we've managed to be able to play our sports, provide that opportunity for our fans, find a little bit of normalcy, and to be able to keep everybody safe.
Well, as former Economic Community Development Commissioner under Governor Haslam, I've had several people ask me what kind of impact COVID has had, and particularly with the school population, a lot of it being virtual, and the loss of football patronage over the course of the seasons, how that's affected the local businesses in downtown Knoxville.
Yeah, so just speaking of just Knoxville alone, I don't know an actual number. I do know just anecdotally it has had an impact. But it's been, I think, not just the athletics, but just the general situation where we're restricting occupancy in our restaurants. We're restricting hours that they can be open, and then within the restaurants restricting or having more social distancing. And so that has been a challenge for a lot of our restaurants and for our hotels as well. As many people coming in. The city of Knoxville, the county of Knox County, used to estimate that each game generated a $100 million economic impact. I don't think the county has had the opportunity to do an estimate this year based on the lack of fans coming in, but it has been, I'm sure, a very significant impact. The good news is, so far though, this fiscal year and last year, the Knox County has actually had an increase in sales tax revenue. So people are spending a whole lot less money on entertainment, but they're still spending the money. They're going out and buying boats. They're buying big screen TVs. They're buying lawn and garden projects for their home. And my business, which by the way I did sell the 1st of July, but I'm still keep track of. But pet business has been also booming. People are buying or adopting dogs and cats and buying products for the dogs and cats. So it's been a very uneven year. So I think oftentimes the media will talk about all the negative, and there's been tremendous negative, no doubt. But it's also been a lot of positives for other businesses. So what we've really seen isn't a big decline in the economy, but a big shift in the economy. And again, if you're on the wrong side of that shift, it's devastating. If you're in the restaurant business, I think Jimmy, that I also own a minor league baseball team.
Right.
We've had zero revenue, so that's at the far scale. I mean, we have zero revenue in that side of the business. So again, it's been a very mixed year. But in general, Knox County is actually up in revenue overall so far this year.
And that's the way it's been trending across the state. Even in Warren County, our sales tax revenue has been even above what it was last year. So people are spending online and they're spending on basics, but they're also splurging a little bit as well as they've been spending more time at home. I heard on the news line today that there may be a push across the nation to move particularly college students to the forefront of getting the vaccine as a priority level, or move them up in the pecking order to get access to these vaccines. So what are your feelings about vaccines for college students being pushed up a little bit in an earlier phase than in a latter phase?
Well, actually, I'm not sure that I necessarily agree. However, I'm going to follow whatever the health experts recommend, because they are the experts. But from what I understand, in the phases that I've seen so far, we're in phase 3 of the 3 phases. With phase 1 being your medical professionals that are dealing on the front line with COVID victims, and then other people in the healthcare field, and then also in phase 1, I think they have all of our first responders, police, fire, and those folks. And that seems to make sense to me. And my understanding is that phase 2 is going to start with people that have comorbidities and that are elderly. Close to 85% of all the deaths are people over the age of 60. And so it kind of makes sense to focus on the people that are at the most at risk. I think we're in the lower category, and based on our numbers, one, there's very few fatalities amongst college students, and two, we just with our university, I have had very few serious illnesses. So we would love, from a self-centered or self-interested point of view, I'd love to have all my students get vaccinated ASAP. But again, we probably have one of the healthier populations, one of the least at-risk populations, and we're keeping them, contained on our campuses for the most part. And so I'll again defer to the public health experts, but I think the priority for the people that are the most at risk and the most on the front line probably seems to make sense to me.
Well, I've been on several conference calls over the last week with the White House and the Governor's staff, Department of Health, and there's another meeting today, a summit with the President, Vice President, and his team, and they're going to be discussing a little bit more about vaccines and the distribution and sharing a little bit more information about that plan. So we will wait and see. Another question I have, and we've discussed it many times, is the impact that education has on the economy. And one of the things that I know you're proudest of is the development of the Tennessee Achieves, the Tennessee Promise program. And, one of our locals, Chrissy Walker de Alejandro, is actually a big part of that in in the Tennessee Achieves. So if you could discuss a little bit about the impact of that has had upon Tennessee and education, but also maybe how COVID has affected Tennessee Achieves and the participation and the number of mentors that we've been able to recruit.
Yeah, thank you for that. And actually, this gives me the opportunity to give a shout out to Chrissy de Alejandro, formerly Chrissy Walker, who's from Warren County and McMinnville. So I've got a lot of things to be thankful for and appreciative of Warren County and McMinnville, you as being one, Jimmy, but have to say no one more so than Christy. Christy's been a partner and a friend for the last 13 years, was a founder that's been the original executive director, the only executive director for Tennessee Achieves. It started off as a little idea in Knoxville to send kids to technical and community college free, matched with a mentor, but requiring them to do some community service. So the headline today, this last month, we celebrated 100,000 students across the state going to college as a result of this program. We've trained over 80,000 mentors, and all of these students have done nearly 3 million hours worth of community service in these 12 years. And none of that would have happened without McMinnville's own Chrissy Walker Delahondro. She's done a tremendous job. Every year, though, we had to go out and recruit new mentors, and we're a little over 9,000 now. We still need more mentors. The most important part about the program is finding young people that have a desire for education but maybe don't have a family member or role model in their life that's ever been. And a mentor is so critical to the success. It doesn't do any good to send them to college if you don't graduate them. And that's where the mentor comes in. We want to make sure that these students not just go, but actually graduate or be successful. So there's an opportunity, tnachieves.org. You can Google that now and go on and sign up and be a mentor and make a difference in somebody's life. I've been a mentor for 12 years. I'm busy. Everybody says they're busy, but I'd maybe suggest very few people that are busier than the president of UT. But I can find the time because it's just important and it's worth it. As far as the pandemic is concerned, actually, traditional age students, 18 to 22-year-olds, a typical high school graduate, our FAFSA numbers are up. Our applications are up this year by a small amount, but they're up. So we're encouraged by that. But where our state has suffered is with non-traditional or working adults declining. Parents and working adults that were going to community colleges have been worried about their jobs, worried about their children not being able to go to school and having to be at home with them. And so many of them, a dramatic number of them, have dropped out of higher education. We're hopeful that they'll come back, but that's been a huge hit. And as you mentioned again, Jimmy, as a former Commissioner of Economic and Community Development, we always said educational attainment is workforce development, which is economic development. You don't do those things, you're not going to be able to bring the jobs to the state.
Well, we thanked you for that in Warren County quite a bit. Of course, our robotics program, our mechatronics program, and Tennessee Achieves has played right into that and been very successful. Our CTE program at the high school, we got a $1 million GIVES grant to partner with our TCAT. So technical education is being promoted across this region, and you being a former commissioner of ECD know the importance of those programs and how it's moved really everything that we've done forward in such a way that, progress is there. We continue to be successful, and the state's very proud of what we've been doing, but it's been due to a lot of leadership across the years, and you've played a big part in that as well, so we thank you.
Well, thank you, Jimmy, and you've always been a great leader across the state. As former commissioner, I got to work with city and county leadership all across the state, and you've always done a fantastic job, and formerly at McMinnville and now at Warren County, and understanding just how important education is to the economy. And it's always great to be able to partner with leaders like yourself that understand that.
And I appreciate that remark as well. So these have been hard times, and it's with the challenges for our school system. It's been hard to keep kids in school and the doors open and everyone's safe, but we've done an exceptional job, and we'll continue to do so. But once again, the challenges are there every day, just as they are for you at UT. Just a little as we're closing up here, what do you see next for UT moving forward in this next coming year? Anything new in development, anything new as far as progress? I know there'll be some consolidations and some other things done, and how that's going to affect learning and remote work and the things across the system that might be more cost effective and really move the university and its operations forward in a new 21st century of technology.
No, it's going to be a transformational year for everything you just mentioned. In spite of all the difficulties and challenges that the pandemic has caused, it's also an accelerated learning curve, especially in regards to technology and remote and virtual learning. And so we're going to be doing a lot of things more efficiently and better, and also the way we work. Our staff will need less office space and be able to work more efficiently as a result of some of the things that we've learned. So a lot of changes in that regard. Also, the university is looking to make this the greatest university, or the greatest decade in the history of the University of Tennessee. And one of the ways in which we will do that is look to find new ways to serve more students. One of the things that we're debating and discussing at our board meeting tomorrow afternoon, in fact, is the opportunity to have Martin Methodist College, a small college in Pulaski, Tennessee, in southern middle Tennessee, join the University of Tennessee system. It'll be the first new college to join us in 50 years since the University of Chattanooga did in 1969. This school provides 80% or 40% of the graduates are nurses for the local community, 40% are teachers for the local community, and they're a key contributor to workforce in that part of the state. And our goal is to make their college more affordable to more people in that region. So we're excited about having a conversation with the legislature next year about adding the first new undergraduate college to the UT system in the last 50 years. And it'll be an interesting and hopefully very rewarding year next year if we can get that accomplished.
Well, you know my unending support for UT, since we're both graduates from there, went to school there at the same time. I'm wearing the mask that you sent me with Tennessee Strong right now and my orange tie. So I like the color orange and have for many years now. So we do respect your leadership and the new direction that you're taking the university. I've worked with you on many projects and know your commitment to improving the lives of all Tennesseans, from young to the old and everyone in between. And your philanthropy, your dedication to the Tennessee Achieves program is monumental when it comes to the future of our state. And so I know Jenny, your wife, has been a big part and a sidekick, and been there for you through all of this. And I appreciate all that she's been doing over the course of years to support your efforts. And we welcome you to come back to McMinnville anytime to spend a few hours or a few days. And so are there anything, parting words you want to leave with our listeners today?
Just thank you for the opportunity to share a few ideas of things that we're working on at UT. Again, it's been a difficult year for all of us, but I appreciate everybody that's worked so hard at all of our counties and at the University of Tennessee to keep our people safe. We're going to get through this. We got vaccine. We've learned ways to deal with it. We've got vaccines on the way, and I'm still convinced not only is it going to be the best decade in the history of the University of Tennessee, but for the state of Tennessee as well.
And sometimes,
thank you for letting me join you, Jimmy.
And sometimes those challenges give great opportunity, and so we'll continue to do that. I'll leave a little quote from Abraham Lincoln. He's one of my favorites, and I like to quote him a lot, but it was on the subject of education. He said, "I can only say that I view it as the most important subject which we as a people can be engaged in." So thank you for your service to the state of Tennessee, President Boyd. You take care and be safe, and you tell your family we send our love and affection toward them as well.
Thank you all so much. Appreciate it, Jimmy. See you soon.
See you.
And happy holidays.
Happy holidays to you as well. So we want to thank President Randy Boyd for joining us today and giving us some updates and a little bit about the UT system and the safety measures that they have taken over this pandemic. Today we also welcome to our show members of my preparedness team. We have Dale Humphrey, CEO of River Park Ascension St. Thomas, and Grant Swallows, Director of Warren County Schools.
Thank you, Executive Haley. Good morning, Warren County. Tennessee is now currently has 408,000 cases, and yesterday we had over 8,000 new cases reported. We've also surpassed the 5,000 death mark as a state, and we're maintaining a death rate of approximately 1.2% compared to the national death rate, which has now slipped slightly to 1.8%. The highest number of cases reported remains in the 21 to 30-year-old age group with 77,000 cases, and the average age of those who have died is age 40. As a state, we've performed almost 4.7 million tests with a current positivity rate that is up from 14.8% last week to 18.6% currently. The number of hospitalizations in Tennessee continues to set new records, with 2,529 cases currently hospitalized, as does the number of patients in the ICU, with 635 patients in the ICU. Both are new records. ICUs currently in the state of Tennessee only have 9% of their capacity available. Warren County stands at 2,702 cases with 2,343 recoveries. We remain at 20 deaths, which decreases our death rate to 0.7% in Warren County. We've had over 24,000 tests performed, and our positivity rate is up from 15.9% last week to 23.6% currently. So almost 1 in 4 of everyone tested is positive. Our highest one-day total of new cases so far was on November 28th, with 106 new cases reported in Warren County. Our current 14-day average is up from 25.6 new cases per day last week to over 30 cases per day this week. At St. Thomas River Park Hospital, we currently have 15 COVID-19 positive patients hospitalized, 7 of which are in the ICU, and our total census is 52 patients. Early in December, we have been averaging about 10 COVID-19 positive patients per day and 5 COVID positive patients per day in our ICU, and our average daily census has averaged 45 patients per day. But the predicted peak from the Thanksgiving holiday is December 11th, and we're certainly expecting many more cases. We continue to offer monoclonal antibody infusions to outpatients early in their disease course, which helps clear the virus sooner, and these treatments most certainly have helped us in Warren County decrease the number of COVID-19 positive patients requiring hospitalizations. We are anxious to begin administering the Pfizer vaccine on the 15th of this month, as all goes as planned, to the frontline staff in high-risk areas. We continue to limit visitors in these high-risk areas of the hospital and are following our masking and screening guidelines, as we have done for several months now. Please wear a mask, social distance, wash your hands, and get a flu shot if you care about anyone other than yourself. Thank you for watching. Please continue to be safe and diligent. May God bless and protect you and your family. And now we will hear from Grant Swallows, Director of Warren County Schools.
Good morning. Thank you, Dale. Thank you, County Executive Haley. Just want to update everyone, as we've tried to do, about the status of Warren County Schools. We did, again, come back to in-person learning for all of our schools last Monday. We are continuing with that. We are continuing to monitor our numbers as well as those Dale just mentioned. I will let you know that we did release yesterday that we do have 46 students that are isolated. That is 0.7%, 0.7% of our student population. We have 482 students that are quarantined. That is 7.9% of our student population. Our staff numbers are 24 isolated. That's 1.8%, and 30 are quarantined. That's 2.2% of our population. Now, we do want to update, and I've said this in a couple of different places, but the CDC and the Tennessee Department of Health did release last week updated guidance and recommendations around quarantine. If you will remember that in weeks and months past, if you were a close contact and you were quarantined for 14 days, that number has been lowered from 14 days to 10 days, with the possibility of getting a negative test after 7 days. If you get a negative test after that 7th day, then you could return to normal activity with all the same precautions in place. So as a school system, we are following that guidance. That will help us, I believe, as far as our staff and allowing healthy folks to return back to normal activity. So we will be following that guidance from here forward. Just want to say that just because that number is being lowered, that does not take away the precautions that we've asked everyone to do with masks and distancing and practicing good hygiene. I do want to also make you aware that two different times this semester we have opened up enrollment for VIP at home. We have done that again. We started that Monday morning at 8 a.m. That window will close this Thursday, the 10th, at 3 p.m. So if you are interested or families are interested in participating in VIP at home, if you will go on to our website, warrenschools.com, we have a list of contacts for each school. You find your zone school and call the school, ask to speak to that person, and they will give you the details related to if you want to go VIP at home for students. A couple of caveats with that. If you are currently a VIP at home student and you want to continue in that route, you do not need to do anything. We will continue that way without you having to call and make sure. Also, if you are a student that's on VIP at home and would like to come back to the traditional school setting, then we would ask you to follow that same procedure. Call the school, ask to speak to that same contact person, and they will give you the instructions that you need. There are a couple of situations that we are discouraging students from going to VIP at home, one of which would be if a student is behind in work or failing classes, and we feel like the VIP at home structure is not conducive to education, we would not allow that student to go. And there have been some students that have gone VIP and been asked to come back to school because they've not been keeping up in their work. We would not allow them to go VIP at home at that point. But we do want to offer that. I just want to be sure that everybody is aware that that enrollment window is now open. It will close Thursday at 3 p.m. and we will not take exceptions after that time. So I'd like for as many people that can publicize that. We've put that out on our social media pages and we've tried to publicize that, but we want that to be an option for our school families. Finally, just want to say a good luck to Mr. C.J. Taylor on he's one of our pioneer football players. In about 30 minutes, he will be going for into a banquet where the Mr. Football for the state of Tennessee will be named, and so we're wishing him the best of luck as he does that. And finally, I'll just say, please be diligent, as I say every week. We are doing some great things in the school system. I believe school and education are imperative for our students, and so we're doing the best we can to make sure that we can stay in school and be able to teach our students and to do all the things that we know to be the right things for our students and staff. Thank you.
So I want to thank Mr. Humphrey and Mr. Swallows for all their work and efforts over the last few months. It's been a daunting task for all of us, but as a community, we need to give them our support. If we're going to be successful in combating this disease, we all must work together. So a few updates from the county. My emergency orders will remain in place until the end of the month, following directives from Governor Lee on extending those orders. We do have record cases and deaths across the county. There's probably few people in Warren County that have not been touched by a death or someone in your immediate family who's not had this disease. So you know it's serious, you know it's out there, you know it's real, and it's not getting any better, folks. And so over the course of the holidays, the worst may not be over. These next few months are going to be critical in our survival and meeting the needs of every individual who has any kind of health challenges, both those with COVID and those who may be subject to accidents or heart attacks. Our hospital serves everyone. Our healthcare providers must maintain some level of staffing in order to continue to provide those services and for the safety and well-being of our entire community population. We all must do our part. Once again, wear the masks, social distance, personal hygiene, avoid events and situations that may compromise your health or expose you to this disease. And please respect the health and well-being of all of those that are around you. Our front line of defense workers have been put to the test. It's almost become critical as the number of patients increasing and the number of those who test positive give us a challenge each and every day that we try to keep our businesses open, our kids in class, and our economy thriving. It's going to take all of us together. But hope is coming. With the vaccines, they will be shipped out in the next few days to our hospitals and our long-term care facilities for distribution. And so I've been on calls for the last week with the White House, with the governor's staff, with the Department of Health. There'll be another White House summit meeting today that I'll be a part of at 1 o'clock for the President, the Vice President, Governor Lee, and members of the President's COVID staff. Will be there to explain how the distribution process is going to work and how that vaccines will be distributed in phases across our county, across our state, and across our nation. So Pfizer vaccines will be coming soon, then Moderna, and so they will be distributed based upon a plan that is still evolving as we speak. So very much of that will probably be discussed today at the White House Summit meeting. The first round will probably be in short supply. It looks like there's going to be 56,000 doses shipped out soon. So that will be for our hospital staff, our front line of defense workers, and probably our long-term care facility patients. The next phase will be EMS, law enforcement, and those people that are first responders. And so the plans are evolving, so please be patient. Please do not be calling the health department asking when the vaccine will be available for you. For the general public, it's probably going to be in phase 3, which will probably be late spring, early summer. But that's based upon the number of vaccines that are going to be provided, and the availability of those will be based upon the number of people who actually get the vaccines. But those announcements will be coming soon, and the process will be explained for everyone. In the meantime, it's getting harder and harder to keep our schools open and our government services provided. We all need your help. Follow the guidelines. Do your part. Be willing to sacrifice a little bit, particularly luxuries, over the next few months or during the holiday season. Use a little common sense and be responsible in your behavior. The disease is not going away anytime soon, and the vaccine is not going to be the cure-all, particularly over the next 3 or 4 months, till the vaccine is available for more people. We're all tired, we're all fatigued, we're all stressed, and the holidays add to that. But we've got to remain optimistic. No more fear-mongering. It's just based upon facts and science, and let the medical experts guide us through this, as we have done in the past. Use facts over friction in our approach to mitigating and containing and conquering this virus over the next few months. We're all in this together. We have to accept reality that we all play a part in this process. We all have to lend support to those people who are out there trying to make things better for all of us. We have a great community. It's even greater when it all is said and done, we work together toward a common cause. We want to look back on the year 2020 with hindsight as a learning curve, so that the next year, 2021, gives us greater opportunity to grow and be successful. As your county executive, my team and I have been working diligently over the course of almost 10 months to promote the safety and security of all 45,000 residents. It's not been easy. It has been a daunting task. It's a constant struggle, but it's what we have to do. The hardest decisions are never the most popular ones, and we all realize that. We're still encouraging testing. The health department, they were backlogged yesterday, backed out onto the highway, but those hours have been changed from 10 a.m. to 3 p.m. each day. The lines have been kind of long, but please be patient. The lines are long at McDonald's and the drive-through restaurants at Hardee's, so please, be patient if you're standing in line for testing. County operations will continue to operate as best we can, Monday through Thursday during regular business hours of 8 a.m. and 4:30 p.m. On Fridays, we try to limit public access for cleaning and for mitigating. But if you'll call those offices, make appointments, please, be patient with us. We're doing our best to keep our offices open. I've had to close 3 different offices and departments over the last few days. And so it's not been an easy task worrying about the health and safety of employees and keeping those services open. And so our property assessor's office is closed. The clerk's office at the courthouse is closed. My maintenance department is closed as well until further notice. We're doing this for the protection of employees because without their well-being, we cannot provide those services. So I want to give a shout out to all of our county employees, city employees as well, all of our teachers, all of our front line of defense people. You know, we're doing the very best we can to keep conditions as normal as possible. For county employees, I can't say enough about what you have done and your cooperation and support. And to the public, I'll have to say every tag for your car has been renewed, every deed has been recorded, every tax payment has been received, every order of protection has been served, every dumpster has been emptied over the last 10 months. And so please be patient. That's a remarkable feat. Many counties around us have not been able to match that, but it's because we had a plan. So we have done better than most, but it's still a challenge. So please be patient. As government offices may have to close or be redirected, we'll keep the services as open as much as possible. Call the individual offices. Make sure that we're taking payments in our drop boxes. Many things can be done online, but please call the individual offices or my office if you've got questions about any county operations. We'll try to keep you posted with notes on the door, with messages on our phones, on our website, and information shared through BLTV and our media sources. It's a day-to-day challenge, as we know. We're not sure what the future is going to bring in the next few months, but we know that 2021, things are going to get better. Things are going to return to some sense of normalcy. It's not going to be a perfect world anymore as the challenges will continue. But if we all do our part, things will return quicker, more things will be more satisfactory to people, and 2021 will be a better year than 2020 is. And so Lincoln said the best thing about the future is it comes one day at a time. And believe me, day to day, the challenges, the information, the situations do change. And they take almost immediate action in order to bring solution to that. So thank you for your support and understanding. Your prayers have been welcomed over the course of the last 10 months. But you know, we have to put actions to prayers to make things oftentimes work for the betterment of the whole. We know it's hard. We know that most of you have risen to the occasion and have combated the challenges just like I have, one day at a time. There have been lots of complaints, but a whole lot of encouraging words as well. That's what's helped us get through these darkest hours. So I want to leave you with another quote from Lincoln. I've quoted him several times today. One of the greatest leaders in the history of the world that took us from some of the darkest times where our nation was divided and the number of deaths were escalating every day as Americans fought each other. So today we want to unite and be together and look toward the future of all of us can. And so with the complaints that have been had and the stress that has been endured and the fatigue that has got us all to the point of almost the breaking point, Lincoln said, we can complain because rose bushes have thorns, or we can rejoice because thorn bushes have roses. Warren County, it's time to hunker down for the holidays as we lift each other's spirits up and remember the real reason for this season. We continue to count our blessings, yes, one day at a time. Take care and be safe. We are Warren